Welcome, everyone. I'm Alan Labreek, Director of Digital Health and Innovation at the World Health Organization. And before I start, I just have some housekeeping. The exits are here and here. I've been informed to share with you that there will be an evaluation form after this session, and this is really critical for us to get feedback on PMAC. So if it's a paper form, drop it in the evaluation box, but if it's a electronic submission, you'll be provided with a QR code. So in today's fast-paced world of digital health and AI, one of the things that I think we collectively acknowledge is that strong governance, clear policy, regulatory capacity are absolutely critical ingredients for the foundations on which digital transformation is based. And AI is no exception. I think over the last 3-4 days, as you've been involved in side sessions and hallway conversations and technical sessions, I hope that you've seen and collectively heard that the importance of equity and inclusiveness and making sure that this digital revolution takes everyone along and leaves no one behind requires us to invest in those foundational elements. And I think if there's anything that we can learn from the last 2 decades of digital innovation, it's that we did not invest adequately in the effective governance of the technologies that we were hoping to introduce. And so today we're hoping to learn more about how this collaborative exercise requires everyone to work together. We need to have government, private sector, civil society, industry, all working together in order to promote and ensure fairness and inclusivity. Today, we're privileged to have a lineup of really distinguished speakers, but to moderate this session, we have a really special guest, and that is Dr. Bilal Mateen. Bilal is a physician by training and currently the Chief AI Officer of PATH. He's also a professor of machine learning for health with a global research and implementation portfolio that exceeds $250 million in grants and contracts. Bilal has been an inspiration to many and a source of knowledge and insight for many of us in the room over the last several years, especially during this tumultuous time of rapid growth in artificial intelligence. I can't imagine a more fitting Sherpa to climb today's mountain of thought and conversation. So let me welcome Dr. Bilal Mateen. Bilal, over to you.
Not as tall as Alan. Ladies and gentlemen, it's an absolute pleasure to be here, and a real big thank you to Alan for the introduction. It's always such a privilege to be introduced by a titan of the sector that you respect. It's always a little bit worrying to be introduced by a friend, so I'm glad you stuck to the script. Thanks, Alan. Given that we've had such an incredible setup to the session, I'm not going to spend any more time trying to explain to you what we're going to do today. Instead, I want to introduce the first of our 2 absolutely incredible luminaries that will be doing the keynotes. The first of which, unfortunately, he wasn't able to join us today in person, but he's pre-recorded his remarks. Many of you will know him. Dr. Amandeep Singh Gill was appointed the Under-Secretary General and currently serves as the UN Secretary General's Special Envoy on Technology. In that role, he spearheads the SecGen's strategic initiatives on technology and facilitates coordination across the UN. He's also a member of the UN Secretary General's High-Level Advisory Board on AI and a part of his Scientific Advisory Board. In recognition of the incredible contributions that Amandeep has made over the last several years, Time magazine actually recognized him as one of the 100 most influential people in AI in 2024. We're privileged to be able to hear from him, and thus I'm going to hand it over to him virtually. So if we could start his remarks, that'd be great. Thank you very much.
Greetings. My name is Amandeep Gill, and I'm the United Nations Under-Secretary General for Digital and Emerging Technologies. It's a privilege to speak to you today. The history of health technologies reflects humanity's ongoing efforts to improve healthcare and address pressing public health challenges. From the discovery of vaccines that eradicated deadly diseases to the invention of advanced imaging technologies such as MRI, these innovations have reshaped healthcare. Their impact has relied not only on innovation, but also on governance frameworks that ensure safety, efficacy, and trust. Governance has facilitated progress on health that's equitable and sustainable. The foundations of health technology governance are built on evidence-based approaches and on science. This philosophy has long served as the cornerstone of medical advancements. Breakthroughs such as penicillin or vaccines for polio and smallpox underwent rigorous evaluation. These assessments saved countless lives and ensured that progress reached populations around the world. Today, this global commitment to governance reflects the maturity of these frameworks. At the heart of modern health technology governance lies Health Technology Assessments, or HTAs. This structured process evaluates medical innovations across dimensions like clinical effectiveness, cost efficiency, and societal impact. HTA brings together science, ethics, and policy, providing a pathway that allows innovation to progress while maintaining public trust. However, as we look to the present and future, the healthcare landscape is evolving rapidly and is facing challenges, including the emergence of artificial intelligence. AI is not just an extension of existing technologies, it represents a paradigm shift. Its capabilities include analyzing complex data sets, detecting patterns invisible to human observation, and accelerating scientific processes such as drug discovery. Diagnostic tools powered by AI can identify breast cancer in mammograms with remarkable accuracy and speed, complementing human expertise. Algorithms are personalizing treatments, tailoring interventions to a patient's unique genetic profile. In research, AI is reducing drug discovery timelines from decades to years by simulating complex chemical interactions. Yet, alongside this promise come significant challenges. AI algorithms depend on the data they are trained on. When data sets are unrepresentative, biases can emerge, perpetuating disparities in healthcare. Transparency is another critical issue. The logic behind AI-generated decisions is often opaque, making it difficult for clinicians and patients to fully trust or challenge these outcomes. Ethical concerns around patient data privacy and autonomy also demand attention as AI pushes the boundaries of traditional governance. To address these challenges, the governance of AI in health must evolve. Existing regulatory frameworks designed for static technologies are not equipped to handle the dynamic and iterative nature of AI systems. Standards must be developed to validate AI tools in ways that reflect their ability to learn and adapt over time. Transparency must become a central principle, enabling clinicians and patients to understand and trust AI-driven decisions. Concepts like explainable AI or XAI must be prioritized to ensure these systems are interpretable and accountable. The recent report from the UN Secretary General's High-Level Advisory Body on AI emphasizes the need for a framework to regulate high-risk AI applications, including in health. However, governance must extend beyond regional efforts. AI's potential and risks are global, demanding international collaboration. A unified framework is needed to harmonize regulatory standards, promote equitable access to AI-driven innovations, and establish ethical norms that protect patient rights and dignity. Global governance should also address disruptive technologies beyond AI. Quantum computing in bioinformatics and nanotechnology in drug delivery are just two examples of advancements that will continue to reshape healthcare. Anticipatory governance, policies designed to adapt to unknown future challenges, will be critical in shaping a health future that's both innovative and equitable. Ladies and gentlemen, the governance of health technology is more than a technical necessity. It is a public responsibility. It has to ensure that the tools of progress serve all of humanity with integrity, equity, and compassion. Policymakers, researchers, industry leaders, and other stakeholders share the responsibility for collaborating and creating governance structures that align with public health goals while fostering innovation. The United Nations recognizes the importance of these collaborative efforts in the governance of technologies. Earlier this year, the Office for Digital and Emerging Technologies was established to serve as the UN's focal point for strengthening cooperation, enhancing collaboration across the UN system, and helping countries and stakeholders work together. ODET is working to ensure that technological advancements, including those in the health sector, contribute to inclusion, sustainability, progress, and more. The future of healthcare is being shaped today, a future where AI enhances diagnostic precision, accelerates research, and personalizes treatments. A future where governance evolves alongside technology to ensure that progress remains ethical and equitable. This promise will only be realized if we approach governance with the same rigor, foresight, and ethical commitment that has guided health technologies throughout history. I thank you very much.
I know he's not in the room to receive it, but I think he very much deserves a round of applause. And I do really want to take a moment to thank Amandeep for bringing up this issue of governance and regulation really do have evidence at their heart. And I suspect, much like me, as you walked through the halls of PMAC and you saw these incredible posters of the research that's being done on applications of digital health and AI at the last mile, that we have the ingredients that we need to deliver effective regulatory guidance to all the innovators out there and create the safeguards and guardrails to make sure that we are protecting the most vulnerable, whilst leveraging the opportunity that health technologies and AI affords us. We have another incredible luminary who's very kindly agreed to do a keynote. It's also pre-recorded, and again, I suspect many of you will know him. Vilas Dar is a global expert on artificial intelligence and a champion for equity in the current technology-driven world in which we live. He's currently the president and trustee of the Patrick J. McGovern Foundation, a $1.5 billion philanthropy advancing AI and data solutions around the world for a sustainable and equitable future. Vilas served on the UN Secretary General's High-Level Advisory Board. He's been a US government-nominated expert to the Global Partnership on AI. His LinkedIn course on the ethics and governance of AI, I believe, is one of the most watched LinkedIn courses out there. He not only has a JD and an MPA from a series of universities, but I know that he's qualified to talk on the topic because he just did the Viva for his PhD on the governance of AI in the UK. So hopefully I'll be able to call him Dr. Dar very soon, and I'd like to join me in welcoming him to the stage, virtually.
Ministers, policymakers, practitioners, friends, it's my delight to be with you today. My name is Vilas Dar, and I'm the president of the Patrick J. McGovern Foundation. I'd love to share with you where my own journey in healthcare started, well before the age of AI. You know, in the summers when I was growing up, my family would take me to rural India, where much of my family lived, and those days were filled with a great deal of joy, adventures out in the fields, meeting with local villagers, amazing meals, great conversation. But inevitably and invariably, at some point in my trip, a kerosene lamp would come out, and family members from across the village would gather. They'd bring with them folders tattered by time and by water and by age, filled with every note, every prescription, every exam result they might have gotten from their visits to a village medical officer, to a doctor in a larger town, and their radiological and laboratory examples that had been sent hundreds of miles away and returned to them with a scrawl. By the light of a kerosene lamp, my task was simple and incredibly complex. It was to read what all of these reports had to say, and then to try to explain them in a way that let people connect not merely to the pills they took, but to their hopes, their aspirations, their dreams for what their own health, dignity, and future might look like. It was an incredible burden and responsibility to put on a young person, and yet I saw through this practice just how important this was to people. It wasn't just about what the results of their encounter with a medical professional was. It was about a feeling of agency and ownership, a sense that their health future wasn't something to be told to them by an oracle and interpreted, but something that they could act on. Decades later, the glow of the kerosene lamp has been replaced by the blue light of digital screens and digital tools. And in many ways, we've entered a new era of possibility, one where technology promises solutions that we once thought were impossible. One where AI is potentially reshaping healthcare delivery and modifying everything from diagnostics to treatment, to population health management, to innovation. But as we embrace these possibilities, we have to ask some hard questions. Who's building these tools, and who do they really serve? Who's excluded, and how can we ensure that these technologies don't merely deepen the existing inequities that we have in our healthcare systems, but instead help us build a more just, dignified, and equitable world? I want to start with the promise. Many of you know and have been instrumental in creating the possibilities ahead of us. In clinics and communities around the world, algorithms are detecting cancer earlier, helping optimize treatment plans, and improving the efficiency not just of health systems, but of clinics and hospitals, of care delivery at the front line. In East Africa, we're working with organizations to build AI-powered tools that are enhancing maternal health outcomes, reducing complications for thousands and eventually millions of mothers. In India, we're seeing examples of where voice-enabled AI is empowering community health workers to provide accurate, life-saving information in real time in the most remote areas to people at the front lines of vulnerability. At the Patrick J. McGovern Foundation, we've partnered with organizations like Cushy Baby, whose incredible AI-enabled platforms have improved health outcomes for 3.5 million people across Rajasthan. Their real-time insights have not only improved maternal and child health outcomes, but also helped the state of Rajasthan create its first ever climate health vulnerability index, benefiting 10 million residents. In another part of the world, in Rwanda, another one of our partners, ODARE, has revolutionized infectious disease diagnostics, equipping 40,000 community health workers with AI-powered tools. And by doing so, they've made malaria testing faster, more accurate and scalable, and even in the most underserved areas, creating a sense of access. These stories remind us that AI's transformative potential, when it's applied to real-world needs, can transform, certainly, but can transform not merely the systems, but people's experience in their moments of extreme tension, of critical vulnerability, and places that need real decision-making. But these practices, when taken into account with what's happening in large commercial development institutions and applied to electronic health record systems, reminds us that AI isn't inherently equitable. It reflects the decisions, the values, the biases of those who design it, those who implement it, and even those who govern it. The question is not whether AI will transform healthcare. I think we all know that that possibility exists. It's whether that transformation will happen in a way that includes everyone, that creates universal access, and that lifts all boats. So here's the reality as we see it. Without inclusive and transparent governance of AI, the AI risks exacerbating the very inequities that we are seeking to solve. Consider an algorithm in the United States that underestimated the healthcare needs of Black patients, developing tools that worked for most, but didn't work for those who were most vulnerable, and created pathways to health access that weren't conditioned on the individual circumstance of the person, but rather on aggregated data that had been collected in ways that were fundamentally inclusive. It's not malice. The failure of a data that doesn't capture the full picture of a community isn't something that can be ascribed exclusively to negative intention. It's often that questions about inclusivity and bias in data sets become a corollary. become a side note, become something to be addressed after a system is deployed, rather than built into its very design. The consequences here are dangerous, not because of a lack of representation as an issue of consequence, but because they lead to questions about systemic equity, about those communities that have been underserved medically for decades and risk being so for the future as well. And we only have to imagine the impact of such oversights in the most low-resource settings, where trust in health systems is already fragile and almost at an all-time low. In these contexts, governance isn't a technical feature, it's a moral imperative. It ensures that innovation and ethics work hand in hand, creating a framework that asks, are these tools explainable? Are they auditable? Are they designed with and for the communities they aim to serve? And do they reflect the diversity and complexity of the world they're being deployed in? I'd like to suggest to you 3 key pillars of effective governance of AI. These start at the regulatory level, at the design level, and the implementation level, but they're also principles that need to be held as a part of accountability for those who create and deploy by those of us who use them. That effective governance of AI is, by its very nature, a participatory process. The first is inclusion. We've spoken to some of these issues already and seen the negative consequences when datasets don't include the right population metrics. AI tools have to reflect the diversity of the populations they aim to serve. In how they're designed and deployed, for example, Cushy Baby's work, which I referenced earlier, is rooted in local insights. It enables health workers to address the specific needs of a last-mile village that doesn't have a formal clinical structure and easy access, that requires triage and requires travel, that requires for people to offset their entire lives, their economic opportunities in order to seek medical care. And when that approach is designed with these circumstances in mind, where we bring the power of big data and predictive analytics to improve outcomes, it means that organizations like Cushy Baby can scale up to reach hundreds of millions of people across new states in India. This kind of scale is only possible when solutions are built inclusively, when they're designed not for one size fits all, but rather optimized for the individual circumstances of those who need them most. The second principle here is one of transparency and accountability. Imagine if every AI tool came with a disclosure, a nutrition label is a term we often use, detailing its training data, its potential biases, and its performance metrics. That's the example that Audera's diagnostic AI, which details its data, shows as a part of its transparency as a process in action, a trust-building mechanism. These tools are designed with built-in quality assurance, ensuring that decisions are made at the front lines of care are both reliable and ethical. And the level of transparency doesn't just improve outcomes. It creates better engagement. It creates trust in systems that deliver them. Now, these aren't necessarily disclosures that we think need to be at the front and center of every moment of delivery. In fact, it would be almost irresponsible for us to say that those who are consumers of the medical services need to also be the ones who hold the providers accountable. But for those intermediaries, those clinicians, those practitioners, those community health workers, to be able to be informed, to understand what has gone into building the tool, how it might impact those who are being served, and to ensure that there's a feedback loop that lets them bring that back to the designers, creates real transparency. And finally, a third principle stemming from our work with the United Nations, with individuals and organizations around the world that are thinking about this not as technical innovation driven by a single entity, whether it's a government, a private company, or a nonprofit, but rather to recognize that to tackle the challenges we've described here happens best when done together. It means that partnerships are necessary across sectors and across borders. That global collaboration is the solution. The WHO's digital health strategy, for example, is a powerful example of multilateral collaboration, where initiatives like the AI Foundation Studio are empowering local organizations in South Africa and Kenya to develop their own AI solutions tailored to their unique needs, but bringing in global participation from experts and technological solution providers, by ethicists, and by those who can advise what we've learned and what we need to do to build a better future. Collaboration is not just a strategy, it's a necessity. And by working together, we can create systems that reflect our shared humanity and address the global challenges that we face together. So I'll leave you then with what I think of as the things that we might do to shape a just future together. As we gather today, the future of healthcare is being shaped. It's being shaped in boardrooms and labs and clinics. It's being shaped in the rooms where practitioners like all of you are going out and working with communities. And the decisions we make now will determine whether AI becomes a force for equity or a driver of more inequality. It's not a technical challenge, and to make it sound like one is to reduce the incredible power and the hope and optimism that I have in human institutions. To build moral solutions, not merely technical ones, to build societal solutions that incorporate all of us and give us a path forward. We know what's possible. I've shared with you some of our relationships with our partners that are helping health workers in the most remote areas save lives, increase the quality of life, and create more access and trust in our health systems. And they aren't isolated successes. They're blueprints for what we could achieve together. It requires all of us. It requires a commitment to systems that uphold the values of trust and equity and compassion, that recognize that technological innovation can be an incredible driver, but there's no inevitability to the idea that technical innovation will lead to a more just society. But if we come together to ensure that AI doesn't just serve those in modern hospitals with access to LLMs, but reaches those who still think about their health in the context of the flicker of a kerosene lamp, who still are underserved and underprivileged, who are as deserving of health dignity as anybody else on the planet, then it becomes our moment, our opportunity to build systems that reflect the best of who we are and the future that we hope to create. And the time to act for us is now. Thank you.
Another brilliant keynote. And what I'm going to do, because I appreciate we are running short on time, is jump to introducing our panel for this afternoon. So first up, we have Jean-Philbert Nsingimana. Phil is the Chief Digital Health Advisor at Africa CDC. He's dedicated his career to unlocking the potential of technology and data for African prosperity. And prior to serving at Africa CDC, he served as the Minister for ICT and Youth in the government of Rwanda for 6 years. During his tenure, he spearheaded the Smart Africa Alliance and Youth Connect Africa, two Pan-African organizations focused on accelerating digital transformation and youth empowerment. Next up, we have Dr. Kidong Park. Kidong is the Director in the Data Division Strategy and Innovation at WHO's Regional Office for the Western Pacific. He's a public health physician with 30 years of extensive experience in global health, both in national and international settings. Kidong first joined WHO in 2006, working with the Global Influenza Program at WHO headquarters, and after 3 years in Geneva, moved to the WHO Regional Office for the Western Pacific, based in Manila. And last but not least, we have Professor Marianne Hartley. Annie leads the Laboratory for Intelligent Global Health and Humanitarian Response Technologies, an international research group based at EPFL in Switzerland. She also is based out of Carnegie Mellon University, Africa, in Rwanda, and the Harvard Chan School of Public Health in the US. Her team works with NGOs, humanitarian response organizations like Doctors Without Borders, and the International Committee of the Red Cross to develop implementable AI-powered technology that provably improves lives in low-resource settings. It's an absolutely brilliant panel, and will you join me in welcoming them to the stage? Welcome, welcome, welcome all. We've just heard from two absolutely brilliant speakers, and I want to try and figure out the transition from them sharing their thoughts with us remotely into all of you in the room, your experiences at PMAC. And so I just want to start with a quick, what reflections are you taking away from what Amandeep and Vilas just shared? What's the single thing that's stuck in your mind that you really want to reflect on and share something with our audience? Do you want to start, Phil?
Yes, sir. Oh, it just works. I was looking for a button to press. Well, I think the story shared by Vilastar about his growing up in India and visiting rural India really stuck with me, because it took me back 4 years ago when I was also growing up in the rural Rwanda, and the story with the the kerosene lamp. It's a story that I know very well because my formative years, my first 8 years of education, I did all my evening homeworks on the kerosene lamp. And today, as we sit here, there are still 50% of the 1.4 billion people in Africa whose story remains the same. It's their current reality. 50% of people who don't have access to electricity, who don't have yet access to internet and broadband, and who live somewhere beyond 5 kilometers from the nearest health facility. And the story he tells really sort of echoes the responsibility that we have here to not leave those people behind. And I feel it's a great sense of, it's a burden, collective burden on all of us to make sure that as we move from industrial revolution to the digital revolution to the AI revolution to the nanotech revolution and supercomputing, we don't leave those people behind. So that's really what I
And
took from there.
it's such a great point, Phil. It sometimes feels like when we hear about the $1 trillion announcement in compute infrastructure, it is a little bit at odds with the reality of many people's experiences. Kidong?
Yes. So my 2 words is AI for human. AI itself do nothing. I believe, I have very strong belief that healthcare workers who are empowered by AI-assisted tools, healthcare workers who are capable to use AI tool wisely, and there's people empowered by AI tool, people who knows how to use AI wisely, can provide better healthcare services and can improve people's health. To help these healthcare workers, we need ethical and well-governed AI, which is also as a human should do. That is as my reflections from the Villa's talk, and back to Amandi's talk. I would also quote UNSG Gutierrez' statement when he established high-level advisory group, high-level advisory body on AI. He said, globally coordinated AI governance is the only way to harness AI for humanity while addressing its risk and uncertainty, which I fully agree with him, and which I think we can discuss further, elaborate further, how we govern AI for health, in health sector. AI for human, AI for humanity. Thank you.
Thanks, Kidong. I'm definitely going to come back to you on that point in a minute. But Annie, do you want to jump in?
Yeah, I mean, what can you say to those talks? You can't disagree with them. I mean, how is it possible to disagree with the need for transparency, representation? It's obvious, right? It's a human principle. It's a human right. We've had these principles since the beginning of humanity. In Africa, we know it as Ubuntu. I am because we are. Participation is essential, especially when we're making these new kinds of technologies. But it's really important to know that those are values. And the time is now, as Villa said before, to act, to do something that actually takes those values and puts them into something that we can do now. That's what I'm here for, I suppose. I'm supposed to be the practical implementation scientist, representing the tools that we are making. And I think what's really important is that participation, it's never been more tangible in AI. Before, people found it very difficult to engage with. You had to be an AI expert to make the tools or to be even involved in the co-design. You couldn't imagine developing them if you were a doctor. But now, with conversational agents, right, these are tools that you can speak to. You can nudge them, you can teach them, and you don't need to know anything about AI. You can tell a model when it's wrong, and you can make it better. For the first time, we've got doctors and end users and the people and communities that need to benefit from these tools having a voice in how the tools should be developed. It's tangible, it's there. And that's why we need to actually just formalize that and make sure that we can make participation tangible. I suppose that's why I'm here as well, because we are trying to do that with a tool that we call Move. It's a massive, open online validation and evaluation platform that formalizes this process by massively, and massive is important, you heard that here. Who are we participating with? Who are we making participants? Everyone. And what are we validating? Everything. You can ask models any number or combination of questions and have any permutation of answers. How do you validate that? It changes all the time. So it's important that we massively validate it in an open way, and we take the validation of people, the feedback, those nudges, the evaluations from our doctors about how they feel about the tool, and to put it back into practice, to feed it back into the model. Technically, it's pretty easy to do. And we've made a platform and it exists, and now we just need participation from people to evaluate the tools massively and to take that and put it back into the models so that we can localize and contextualize, as you heard both of those talks there suggesting, contextualize so that we represent the nuances and cultural differences that are so important to understand, to deliver health effectively, and to ensure that we cover the needs of people as they are and where they are and their expectations. So all we need to do now is recognize that this costs money, and it's not 3 kids in a garage somewhere that's going to do it. We need massive scale infrastructure, we need neutral spaces, we need systems like academia to ensure that we can actually deliver these tools at scale, and we need to try to get investment from people who would normally be investing this in startups and small little fragmented initiatives, to invest them in places that can actually scale in a massive network of neutral and unbiased space that we can actually develop these tools and give that feedback to ensure participation, transparency, and accountability.
Thanks, Annie. Maybe not 3 guys in a garage, but 60 Chinese software engineers, maybe? I'm so glad you shared an example of one of your innovations. I'm going to circle back in a moment because it's been a real privilege to see how quickly your team has innovated. And I'm curious how you balance that against the growing, I think, burden of regulation and governance, if I can frame it like that. So I'm going to put a pin in that for a second. But Kidong, at a time when it feels like multilateralism is almost under attack, I want to recognize that WHO has done an incredible amount to facilitate the governance of digital health technologies. And I wonder if you want to share a little bit about the work that WHO has done, but equally help us look to the future. What role do you see for WHO in supporting the regulation and governance of AI in health?
Thank you, Pilar. So thank you for mentioning of the multilateralism. So let me explain you from the basics of what is WHO. So WHO is the UN system agency that connects nations, partners, and the people, so to promote health, keep the world safe, and then serve the vulnerables. So everyone, everywhere can attain the highest level of health in achieving the common goal of the global health for all. So moving forward, so 3 billion targets of the promote health, protect health, provide health. WHO plays critical role through executing its unique mandate. We, WHO, track the world's progress towards the 3 billion targets as well as health-related SDGs. We, WHO, deliver public health goods on norms and standards, data and research for the benefit of the whole country, not some small number of countries, for the benefit of the whole country that are essential to achieve the global health goals and targets. We also facilitate the cultivation of the ecosystem in science, research, data, digital technology, and health innovation. Supporting the governance of the digital technology, including AI, is a key priority of the WHO work in this area. We call this power health. We can say 2018 is the year WHO became an active player in this area, governance of the digital technology, including AI. In 2018, WHO, in collaboration with ITU, International Telecommunication Union, established AI for Health Focus Group. It brought over 100 experts and the researchers together to develop a benchmarking framework for international policies and then standard to support governance of AI in health sector. This focus group was migrated into a wider platform in 2023. In July 2023, WHO, ITU, and WIPO, World Intellectual Property Organization, jointly launched the UN Global Initiative on AI for Health, which has 3 strategic objectives: enabling, facilitating, implementing. Enable ethical governance of the AI for health by setting standard and norms and the guidance for governance and policy frameworks. Facilitating the establishment of and then strengthening of ethical governance AI for health through pooled investment and the global community of experts. Implement the initiative by supporting sustainable models of the AI programs implementation at the country level. To do this, through this forum, through this framework, WHO produced several guidelines on those, which included ethics and the governance of the AI for health, published in 2021, generating evidence for AI-based medical devices, also published in 2021, and the regulatory consideration on AI for health, which was published in 23, and then ethics and governance of AI for health, large multimodal models, published last year. These guidelines are very well received by member states and stakeholders in the ecosystem, in the AI and the digital technology, which by number I can say over 300,000 downloads of these guidelines. WHO also launched an online introductory courses on ethics and governance AI for health for stakeholders and researchers to learn basics of the ethics and the governance of AI for health. I'm from regional office at Western Pacific, and then I also say something about what our region is doing. Last October, the WHO Regional Committee for the Western Pacific endorsed the new vision of the WHO in the region. We call this weaving health for families, communities, and the societies in the Western Pacific. One of the top priorities of that new vision is expanding the ethical use and then governance of the AI, governance of the digital technology, including AI. We, WHO Regional Office, will support countries in adopting WHO Global Guidance on AI for Health into their national framework, national policy, and then the national legislation. We, WHO at the region, provide policy and technical assistance to member states in strengthening governance and regulatory system on AI for health. We will support member states also developing next generation leaders for future ready health system, which is a digital age, which is AI age. This what is 2% of the contribution of the WHO in moving towards digital age, AI age.
Thank you very much, Kidong. Of the many, many guidelines that you mentioned, I know that several of them are sat outside because Alan shipped them over from Geneva and has laid them out on a table if someone would like to collect one as you walk out. But I now want to go from kind of 10,000 feet, the world's public health agency, to something a little bit more national. Phil, you ran a ministry. You dealt with the thorny issues of regulating innovative digital technologies day in, day out for 6 years. I'm curious, what worked, what didn't, what advice would you have, and what have you seen translate in your role at ACDC across countries? Because Rwanda is a bit special.
So what I would say is that governance of AI is not all about regulation. I think we need to approach it in sort of a more multifaceted way, and there are 5 things that we really need to pay attention to. I sort of lump them into 5 Ps, which summarize very much the principles that have been discussed. But the first P is people. You know, governance of AI need to be centered on people, putting people's interest first, for the people, but also by the people, and I think that's the essence of participation. The second P is about the policies. The way we approach policies in a progressive way, policies that create an enabling environment for ecosystems to form and strengthen, policies that don't stifle innovation but promote innovation while providing the guardrails that are important. So in my experience, it wouldn't be right just to set up a regulatory authority for AI or AI for health and then start giving orders and commands to people. It needs also to listen to people and encourage and promote. The third P is about partnerships. I think it cannot be overemphasized that no one single actor, however powerful that actor is, can impose a governance model that needs to be applied by everybody. I salute the fact that WHO provides the guidances, but those guidance need to be adapted to the local context, respecting the global principles that are timeless, but also taking care of the actual context in which people live. The fourth P is about platforms. And what I mean by platforms is the fact that with the AI, the regulation, the principles and the rules need to be embedded, baked right into the platforms themselves. Whether it is about privacy protection, whether it's about safety, whether it's about lack of bias, it is translated into the platform themselves so that when a platform has passed the health technology assessment or evaluation, something that Amandeep talked about, then you know that this can be deployed almost the same way as a medicine is distributed in the market, and you know that it will target the disease and not bring harm to the body. So I think the platforms need to be somehow evaluated, and I think that the attempts to do sandboxes, for example, is a great attempt to evaluate and vet the technologies before they go into the population at large scale. Finally, I would say it's profit, the fifth P, it's profit. It's important to realize that AI applications, innovation needs to deliver value, not just economic value, but also social value. But in the context of Africa, we don't want to see AI that is only developed through donor funding. There has to be an economic business model behind the development of AI so that it can sustain and scale over time and not really perpetuate the donor dependency problem that is acute, especially this week and the last couple of weeks. Thank you.
Thanks, Phil. And talking about unfettered power and imposing your will on others, I'm just going to say sorry in advance to the organizers who are at the back, because I'm going to run about 5 minutes over. Sorry. Annie, we've heard now from 2 people who have very much been on the side of figuring out what regulation and governance need to look like. I'm curious from the perspective of the humble innovator who is subject to these rules and trying to do incredible things, as you have done with Metatron and Move. What are you worried about? At what point do you look at the conversation, or do you hear the conversations going on and think maybe we're not striking the right balance and getting to a world where we found what pro-innovation regulation might look like?
Yeah, well, as a scientist and a researcher like yourself, I'm much more, I would say, optimistic. Science has survived many, many, many bad decisions in regulation. It's been around for a very long time, and it will never go away, right? It is a celebration of our curiosity, our creativity. It's our respect for evidence that we need it in order to make decisions, right? It's not going to go away. Science doesn't take sides, and sometimes regulation does. Science sits at the seat of what we call equipoise, which is this space, like in a philosophical sense, where it's really at a genuine uncertainty and a celebration of that. A celebration of uncertainty that doesn't take the cowboy kind of view of, let's go, this is the best technology in the world, and we're going to use it with unfettered enthusiasm. It doesn't also take the very pessimistic view that this is going to be killing the entire world. It takes an evidence-based approach. And so we actually are not affected by regulation in that way. And we can continue to innovate regardless of what happens around us, because we have this protected space where we can ask questions and evaluate the answers, because we are not taking sides. Academia is a very, very important place right now. We need evidence to make regulations that are sensible, and we need to invest in places that are genuinely neutral so we can make sure that we can evaluate and validate the stuff at scale. And that's what I think needs to happen. What kind of regulation will empower us? I would say regulation doesn't have to be a law, although that's its definition. I'm being a bit liberal here with the definition, but it can also just be organization. Help us from the 10,000-foot view, organize people so that we can get enough experts to ask the amount of questions that we need in the models that we are making, and also organize, for instance, fundraisers to recognize our potential to do that, to invest in the neutral space. And it does need to be profitable. Totally agree with you. But we don't have to profit from it. And that's our key goal. Venture capitalists can invest in us. People can invest in us to make sure that we make technology that represents people and opens up a market to them. The majority of the planet is in a lower resource setting. Why wouldn't you want to open up the market to them? And, as a nice side effect, actually have impact. So I really think that organization as regulation and collaboration and helping us really de-egotize, if that's a word, the academic space to ensure that collaboration, I think that will be extremely helpful.
Amazing. Thanks, Annie. And to close out the session, and as soon as we hear from Phil, I'm going to ask you to erupt into a round of applause to thank our speakers. But you each get one sentence. What is the single thing that we need to do in the next 12 months to more effectively regulate health technologies and AI? One sentence. Annie, we're going to start with you, then Kidong, and then Phil. Go.
Invest in academia.
Kidong?
I would quote Stephen Hawking. He said, "Our future is a race between the growing power of the technology and the wisdom which we use it. Race between growing AI and the ethical governance we are using it." So we are connecting dots and then make the platform to ethically govern AI.
Thank you, Kidong. Phil?
3C, communicate, collaborate, and coordinate.
Amazing. And we're done, folks. You can run to your next sessions. Thank you so much.